If you have poor circulation to your feet, are diabetic, have a history of cellulitis, or end up in wet socks frequently, you are at risk for toenail fungus infections. At first you may notice a small white or yellow speck under your nail. You may not even notice it. Before long, as the fungus grows, your nail will become brittle, maybe even crumbling. The nail will be discolored, and the edges may look frayed. You need to start treatment as soon as possible before the infection spreads further. An over-the-counter, high-quality antifungal cream will take care of the problem. In the beginning stages there is really nothing to worry about with the toenail fungus. Once it gets spreading, the microorganism growing, you may find yourself with a smelly, bleeding, pursuing toenail. This is when it becomes harder to cure toenail fungus. Since it is under the nail, and protected by it, the treatment can take up to a year to completely kill off the fungus. You may experience some pain as the toenail starts to pull away from the toe. You may also end up with other, more serious infections from bacteria that enter through the broken skin. It is important that you start any toenail fungus treatment at the first sign of an infection. A good cream can take care of it quickly at the outset. As it progresses, the time for complete cure gets longer and longer. The longer you have it, the more susceptible you are to other infections. The worse it gets, the more likely you will need doctor intervention. The oral prescriptions from a medical doctor have a number of possible side effects, from skin rashes to liver damage. It may be necessary to undergo surgery to remove the nail to actually get to the fungus. Keeping your feet dry is a good start to avoid getting a toenail fungus infection. Wear socks that absorb moisture, and change them often. Wear open-toed shoes if possible, letting your feet out. If you must wear closed toes, wiggle your toes frequently, trying to keep the circulation flowing. Clean your feet with an antimicrobial soap to prevent infections. Most importantly, treat a nail fungus immediately with a good antifungal cream, and treat until after there are no more signs. Treat the toes adjacent to any that show infection too. Prevention will save you time, money and pain.